Good morning. This is Anissa Higgins, and I'm recording this video for an assignment for Module 3 in my Substance Abuse Prevention course. Um, Needed to answer a few questions about um, creating and implementing prevention program for substance abuse. My topic was preventing opiate or heroin overdoses. So my goal is to answer these questions as they relate to that type of program, substance abuse prevention program. And again, my name is Anissa Higgins. This assignment is for Module 3 of the Substance Abuse Prevention course. We were to make a video to answer the questions for that module. So without further ado, I will go ahead and do that. And the first question that I need to address is a question that reads, and please bear with me because I'm not I'm not really tech savvy, and I'm not a really good public speaker either. So please bear with me. But the first question that I need to address is, how might you improve awareness of substance abuse problems and readiness of stakeholders to address these problems? And just based on my reading the information in preparation for this assignment um, that was assigned to us, as well as just doing my own research, trying to gather further information and make sure that I'm educating and answering the question correctly. How might you improve awareness of substance abuse problems and readiness of stakeholders to address these problems? The following are some strategies for raising community awareness. Meet one-on-one with public opinion leaders. Ask stakeholders to share information in their own sectors. Submit articles to local newspapers, church bulletins, club newsletters, and so on. Share information on relevant websites and social media outlets such as Facebook, Twitter, Instagram, those types of outlets. And then also host community events to share information about the issue and discuss the problem in detail, for further awareness. And then you would want to convene focus groups to get input on prevention plan. So a focus group can help to, generate ideas and share those ideas, get input from others on the prevention plan. So as far as that question goes, how might you improve awareness of substance abuse problems and readiness of stakeholders to address these problems? That is my answer for that. And I think, it's pretty much detailed, and I tried to list them one by one. So moving on to question number 2. What can be done to strengthen existing partnerships and or identify new opportunities for collaboration? Again, based on my reading and research, collaborative partners are mission and vision based. A collaborative partnership is formed to combine efforts and resources as a more effective and efficient way to address a common problem. So, to maintain a collaborative partnership, it is essential that each partner not only be kept informed of, but also that each partner has a say in any decisions concerning significant developments within other partner organizations. The dynamics of a collaborative partnership are complex, so leaders need to agree on a schedule to discuss aspects of the partnership, such as maintenance of a common vision and resolution, of any partnership difficulties. And I also learned in the reading that due to the closeness of the partnerships, direct interaction is frequent and real human relationships are especially important. So you need to have that human contact. You need to be in constant and frequent contact and having that interaction regularly to maintain those relationships. To maintain these relationships, you should consider creating institutional structures such as annual get-togethers that foster a sense of togetherness and mutual identity. right. So that pretty much addresses, to the best of my ability, the question of what can be done to strengthen partnerships or identify new opportunities for collaboration. And then number three, the third question is what strategies might you use to improve organizational resources? And maintaining those partnerships and resources requires open communication, trust, and reliability. So these types of the organizational resources are need based, based on what I read, and therefore maintenance entails ensuring that the arrangement continues to fulfill each partner's needs. Maintenance of these partnerships requires both members or all members to openly communicate information pertinent to the agreement. And fostering a sense of trust and reliability serves to strengthen the stability of the agreement, increasing the chances that the nature of your partnership will evolve rather than dissolve as a response to your organization's changing needs. And then it goes on to say, even if, and I thought this was very important to include all of this information, as far as this question goes, and as far as my retaining the information and making sure that I understand it correctly. Even if a relationship must dissolve, open communication will make you aware of this sooner, giving you time to make new arrangements and insulating you against future uncertainty. Make plans to talk with someone from your partner who either has decision making power or knowledge of the aspects of his or her organization affected by the agreement. Meet at least twice a year to discuss how the arrangements are working and what, if and what adjustments could be made to benefit all of the parties involved. All right. And then question four is the last question. It asks, what needs to be done to develop and prepare the prevention workforce? I had to do a lot of research on this question because I wasn't really sure about what the prevention workforce was as it relates to my program or to this topic at all. So I had to really read and try to make sense of it. So I hope this answer really is relevant to the question. Again, the question is what needs to be done to develop and prepare the prevention workforce. Based on my reading, the workforce works with federal and state partners to increase the supply of trained and culturally aware professionals to address the nation's behavioral health needs. So my guess, again, this is to the best of my ability. I didn't really understand this question, and I wasn't really sure about my answer. So the workforce is basically your employees, your healthcare providers, substance abuse counselors and professionals, nurses, and so forth, and all of the people needed to run your facility or your